COVID booster shots could be just a few weeks away, but there's still a lot of questions about how this is all going to work. So we got the answers.
As we dig into this topic, you'll notice the QR code on your screen here this morning. Just scan it to get the very latest information on booster shots right now. And we'll also leave it up for the next few minutes as our Lauren Kostick breaks down what you need to know.
The recent push for COVID-19 booster shots is leaving many with a lot of questions. So we asked an expert with the Regan Street Institute to break it all down. To start, what is the booster shot? To put it simply, it's the exact same as the first and second dose you already received. Currently, Pfizer and Moderna are the only two up for discussion.
It's an additional dose of vaccine that's needed sometimes to periodically boost the immune system.
And how would the rollout work? Assuming the FDA gives the green light, all adults will be eligible for a booster 8 months after their second shot starting September 20th. High-risk groups like healthcare workers and seniors get priority. Many are also wondering, if I get the 2 shots but not the booster, am I no longer protected? Yes and no. Studies show the vaccine's effectiveness decreases over time, so the booster shot offers an extra layer of protection, like many other common vaccines.
You're adding to your protection and minimizing the likelihood that you're impacted or that you become a carrier and spread it to other people.
And lastly, can you mix and match vaccines?
We have some data that suggests that might be a possibility for the United States, given what we're seeing.
For now, health leaders recommend you get the booster that matches your original shot. So if you got the Johnson & Johnson vaccine, you'll have to wait a little bit longer.
And the timeline for that J&J booster shot is still really up in the air this morning. But here's what we do know. The vaccine wasn't administered in the U.S. until March of this year. And experts say they're still collecting data. If we look at the timeline for Moderna and Pfizer, their first doses were given in December. And now, 8 to 9 months later, we're gearing up for that booster. So if the J&J shot follows that timeline, a booster shot may not be available until October. But we don't know if the Johnson & Johnson vaccine's protection will fade at the same rate as the other two.
President Biden says all nursing home staff will be required to get the COVID-19 vaccine. The nursing home industry here in Indiana says it wants its staff to get the vaccine, but is opposed to a mandate.
Nursing home operators say a mandate that singles out their facilities would prompt vaccine-hesitant employees to leave for other healthcare jobs at a time when long-term care already faces extreme hiring challenges. In Indiana, almost 83% of long-term care residents are fully vaccinated, but less than 53% of staff are fully vaccinated.
Raleigh Hospital is now sounding the alarm about a record-breaking number of kids coming in with COVID. All this as IU Health tightens visitor restrictions to just 2 people per patient. In just the last week, doctors treated 70 kids with COVID. This time last year, they saw that many patients over the span of 2 to 3 weeks.
Some children have to stay for many, many weeks. And you know, we're grateful that the majority of them will survive. But you know, it is stressful for everyone.
So doctors say masks and social distancing in school are crucial to keep the caseload down, but we're seeing new online claims about masks increasing carbon dioxide levels in kids. So our Verified team did a little fact checking. Take a look.
As kids head back to school, parents are heated over whether masks should be required in class. Some are citing a study that claims masks aren't safe for kids. So let's verify. Do face masks really increase carbon dioxide levels for children? Our sources, the JAMA Network and the American Academy of Pediatrics. In June, JAMA Pediatrics published a study from German researchers claiming children's masks trap concentrations of carbon dioxide that are dangerous for kids. But in July, JAMA retracted that study, citing issues with its methodology and conclusions, saying the authors didn't provide convincing evidence. The American Academy of Pediatrics insists masks will not block the oxygen a child needs, and that carbon dioxide molecules are too small to get trapped by the material.
There is no increase in carbon dioxide. There's no detrimental effect of the mask in any way, shape, or form.
So we can verify this claim is false. Masks do not increase carbon dioxide levels for children. With your Verify, I'm Ariane Till.